presidents of Guinea, Sierra Leone and Liberia, along with top officials from the EU, UN and West African states, are deciding what needs to happen next to handle the disease. Ebola has killed more than 9,000 people. While there has been significant success in reducing cases, this conference brings policymakers and leaders together for the last phase, eradicating the disease or getting to zero. They'll also be looking at the recovery process in the most affected countries, Guinea, Sierra Leone and Liberia. But all this means more resources and more money. Although they may not come up with the answers today, one question will be, who is going to pay for it? Well, the BBC's Anne Sawyer has covered the Ebola outbreak in West Africa. She joins us now from Brussels. There's talk of some sort of Marshall Plan involved here. How much support is there for that, Anne?
Oh, that's right. The three presidents of the worst affected countries are here laying out a roadmap to recovery. The conversation is now shifting from emergency to recovery, and they will be setting out their plans. The donor countries are represented here. Even though this one is not a pledging conference, already we have seen some donors like the European Union, the IMF have already signed deals here today. And with me now is the UK's International Development Secretary, Justin Greening. Justin, this is not a meeting where you've come to pledge, but what kind of commitment is the UK prepared to put into this recovery process?
Well, we've worked hand in hand with the government of Sierra Leone to combat Ebola in that country, and our plan's working. The incidence rates are right down now, but this conference is about bringing the international community together to make sure that we're committed to getting to zero. For the people I've met, the healthcare workers, the people who are doing safe burials, we owe it to them and people who will still lose their lives from Ebola to finish off the job. But as you say, it's also about starting to look ahead, saying what do we need to do in the immediate near term to get schools open, to make sure that healthcare systems get back on their feet. We've got the wet season coming up, malaria is a risk for people in terms of healthcare. So lots of looking ahead, as well as though a recommitment to finish off this job. We owe it to the people who've worked so hard, and indeed to people on the ground in Sierra Leone, Liberia and Guinea, to make sure we get rid of Ebola once and for all.
A recommitment to finish off this job, you say, and what's your assessment of this response so far?
I think it's been an amazing response from the countries themselves, and certainly the leadership of President Corona in Sierra Leone has been critical in helping us be able to get on top of the Ebola crisis. But increasingly, if we're really going to eradicate the Ebola virus, we need to work with communities, and this next phase to really finally get to zero will very much focus on working with particular communities and particular villages to really make sure we can work with them and stamp this out.
Is that feasible?
I think it is. We've already done a lot of it. It's one of the reasons why we've made so much progress. We've worked on the ground with healthcare workers, helping communities understand how they can keep themselves safe, and also making sure then they can get access to community care locally. But there's still more work to be done, particularly around border areas where we're seeing some cases from individuals who might have Ebola then crossing the border and spreading it to villages on the other side. So more work to be done, but we will get there, and this conference is about making sure the international community doesn't get complacent, making sure that countries don't get complacent so that we can finish off this job.
Indeed, the challenge is still huge. Many thanks for that. And this is just the beginning of a conversation, as I said, and there are going to be more conferences next month and in May where donors will be coming together with the countries that have been